Medical lasers have been used for everything from general surgery to aesthetic treatments, so it's no surprise to know that they're very effective in the world of dentistry. Of course, you want a skilled expert using that laser, and they don't come any better than my first guest, who is Dr. Jason Stoner, one of the top periodontists in Columbus. So thanks for being here, Doctor.
Thank you, Robin.
So how long have lasers been in the world of dentistry?
Lasers have been used in dentistry since 1993, and they're it started out with argon and diode lasers, which we use just for general treatment. And for instance, if we were taking impressions or something like that, and there might be a little too much gum, they were used for that. Since then, we've had amazing advancements in lasers and using lasers that work with different wavelengths to do much more than what we could do 20 years ago.
And one of those areas that you use it often in are the gums. So what type of problems and kind of how do you use those to treat the issues?
Yes. Lasers, when we're talking about cancer, for instance, in medical treatment, we can use lasers to target tumors. Wow. and quickly growing cells because of color and wavelength of the tumors. They tend to be very, have a lot of blood vessels and have a lot of color to them. So we can use lasers that target based on color and use optics rather than heat. So before the argon lasers and diode lasers would use heat to treat. Now we can use lasers that don't use heat as much as they use optics, and we can target certain things. So periodontal disease, for instance, which is disease around the gums and the bone around the teeth, tends to be very red in color and what we call erythematous. It bleeds very easily, purple. That's a perfect way to use a laser to target that disease tissue without doing any damage whatsoever to healthy pink tissue. So we can actually target it very specifically.
And I know another area that I found this interesting as somebody who wore braces for a long time is that when a person has worn braces for months or years, things can happen to their gums, and you can also use lasers to treat that.
Absolutely. A lot of times we work a lot with our orthodontic colleagues that have a patient come over to see us because the response of the gums to having braces on the teeth sometimes is to overgrow. And they might even grow all over the braces and over the teeth even.
Wow.
So we can use a diode laser or another CO2 laser to help create beautiful smiles and remove that extra gum that not only makes the smile beautiful again and why you're going into braces, but also to help the orthodontist get the teeth in the right position.
And so all of this, I know that, you know, if a patient walks in and they say there's a regular treatment or there's a laser treatment that we can do, what are the benefits of going the laser route?
Sure. The benefits of laser are enormous. We can avoid, more contemporary treatment has brought us to more minimally invasive therapy, and that's what laser does. There's no cutting with scalpels, there's no there are no sutures. We don't have to add bone in a lot of times. So we're using, lasers can stimulate the patient's body to heal on its own and without adding these expensive and uncomfortable procedures in.
And as we know, unfortunately, some people are afraid of the dentist because they think it comes with pain. And that's a good way to say, listen, we've come a long way. Things aren't what they used to be. This isn't going to be an invasive procedure for you.
Absolutely. And it's been a big practice boost for us.
Sure.
Because a lot of these patients come back, send their friends and tell their other patients that might be going to look for this on the internet, where they should look and see for this type of treatment. The minimally invasive treatment provides for basically no pain medication afterwards. It completely has revolutionized dentistry.
All right, you did also write a book, Amazon bestseller. We've got Dental Implants Columbus.
Yes.
So somebody can probably learn a lot more about what you can do for them through this book.
We actually, that's the 4th book, and I'm on the 5th book now, and they're all on Amazon.com. They're all bestsellers. And it's geared towards the patient, so it can tell the patient in layman's terms what they can expect.
Okay, perfect. That's great. Amazon.com for that. We also have your website up on our screen and the phone number so people can
Great.
find you. So thanks for being with us, Doctor.
Thank you so much.